Good afternoon, all. Myself, Dr. Parth, Kachhadiya, and I'm moderator for today's session. I would like to welcome all the nursing students in our structure training and education program for the nurses. I'd like to welcome and introduce our speaker, Dr. Bhumi, Consultant Department of Critical Care at LM Virani Bhokad Hospital, Rajkot. So we can start. Over to you.
Thank you. Good afternoon, dear friends. I know it's afternoon session and it is very difficult for you, but it is our structure training and education program for the nurses, and this time I have kept the topic is infection control in nursing. And as you are all aware that how important is the concept of infection control is because if it is not under control, then uncontrolled infection can lead to a disaster for each and everyone, including the doctor, patient, relatives, and it is a big harm to the society. So I would try to cover all the important points in this session for 45 minutes, that is infection control. Okay, I will just give you the brief idea of each and everything and have tried to include most of the topics which are included in the infection control, especially for the nurses. So, yeah. So we will be starting with the beginning. 50-year-old male patient, uncontrolled diabetic, post of day 3 on ventilator for 3 days, started having high-grade fever. What you will suspect in medical ICU? What infection? So this is again a dilemma. We are always confused. Means what the patient will be having, whether it is VAP, whether it is COTI, sepsis, bacteremia, non-infectious fever, or all of the 4 only VAP. See, as the patient is on ventilator, then definitely our first diagnosis would be VAP. But to diagnose it, what we require is there are number of investigations and there are few things on which we can stem that it is VAP or it is sepsis. So is there anything of concern or serious matter? Of course, yes. As the patient is having high-grade fever after 3 days, then is it hospital-acquired infection? How will you diagnose it? How are you going to address it? Are there any preventive strategies for hospital-acquired infection? What is its importance? And what is the role of education, immunization, and surveillance? So we will be touching upon all these aspects in very brief in the coming slides. So what is the definition of infection? It is the injurious contamination of body or parts of body by bacteria, viruses, fungi, protozoa, and rickettsia, all with the toxin that they produce. And this is the chain of infection. See, this everyone has gone through and seen this picture any point of time, but our aim is to break this chain of infection. So in between is the infection. See, in between there is the susceptible host, and there are pathogens, reservoir, portal of exit, mode of transmission, portal of entry. So our purpose is to break this infection. Who are the susceptible hosts? We should definitely identify them. Those are the elderly patients, infants, immunocompromised, and anyone in the ICU can get the infection as their immunity is down and they are in the ICU. What is the portal of entry? Mouth, nose, eyes, cuts in the skin. Mode of transmission can be by the direct or indirect contact and vectors. Portal of exit will be coughing, sneezing, bodily secretions, feces. Reservoir of this infection is people, animals, soil, food, water, pathogen, and then the pathogens are bacteria, virus, fungus, and parasites. So we all is about the infection cycle. Now our aim is to break this cycle as every point, and then comes the role of infection control. So what are the standard precautions which we will be taking care in the ICU? And those are hand hygiene and antisepsis, PPE, that is the personal protective equipment or the barrier precaution, sterilization, decontamination and cleaning, waste disposal, Then prevention of the needle stick and sharp injuries, environment cleaning and spill management. So these are the important aspects of infection control. How do we do the handle? See, 8-point handle is very, very important. Just we have been gone through the pandemic of COVID, and we are aware of each and every aspect of infection control. So once again, we will be revising this all the things in our uh, presentation, how we are going to do. So how do we do the handle? It is the 8-point, uh, 8-step hand rub hygiene. Okay, so how we are going to do it, and duration of the entire procedure is 20 to 30 seconds each. So you have to give time, and this is the slide which nicely shows and depicts how we are going to do hand rub in the IC. One more thing I would like to convey to you. See the steps which are given, and you have to keep this slide in mind each and every step, and you have to do it thoroughly in order to prevent infection. See, we are going to prevent infection which is being uh, passed on from patient to other patient. Also, we want to take care that it is not being passed on to the nursing staff, to the doctors, to the healthcare workers who are working in the ICU. So this is the most important aspect for each and every person working in the ICU. When we are supposed to do this hand hygiene. So again, here there are 5 points. That is before touching the patient, before clean or aseptic precaution, procedure, after body fluid exposure, after touching a patient, after touching patient surroundings. So these 5 points are more important when we are going to do the hand hygiene. Then comes the personal protection equipment. And in COVID, we had gone through all the things, and these are must for our own safety. And it comprises of hairnet, goggles, facial, waterproof gown, neck cover, or waterproof boots, shoe covers, double disposable gloves, and N95 mask. So this picture we should keep in mind. How to don and doff the PP. Everyone may have done this. The person, the nurses who have joined this newly, or those who have come into this profession newly joined, they should keep this in mind. How to do and how to do their spatial doning and doffing areas in the hospital, and the disposal of this used things should be done in a very, very proper way. How to sterilize the things? It is done by the autoclave, dry heat chemical sterilants like glutaraldehydes or formaldehyde solutions or radiations. And if we see the classification, it can be done by the physical method and the chemical methods. And more so, few mechanical methods are also available. For physical methods, what we use is the dry heat sterilization, that is hot air oven. For moist sterilization, it is autoclave. For radiation, you can use UV rings or ionizing radiation. And for the chemicals, as I said, formaldehyde, glutaraldehyde are the things which are used. Sterilization by heating with bactericidal liquids, and gaseous sterilization. So these are the ways of sterilizing the equipment and the things which we are using it. What is decontamination? See, whenever we are talking of the infection control, we should be knowing what is asepsis, what is decontamination, what is sterilization. Okay, there is small difference in each and every aspect. See, in decontamination, what we do is it is a reduction in the number of microorganisms on an object or surface, but not the complete destruction of all microorganisms or spore. Disinfection is less effective than sterilization, but it does not kill bacterial endospores. Liquid chemicals and ultraviolet are the means of decontamination. Then the most important concern in the ICU or in the hospital setup is the sharp precautions. That is, many a times we come across the nursing staff or the healthcare worker who has got the needle injury. And how it happens? Mostly it happens when we are trying to recap the needles. So we have to keep in mind we are not going to recap the needles anymore. dispose of this used needles and small sharps immediately in the puncture resistant boxes which are available in your hospital. Needle incinerator can be used for disposal. What are the risks of needle stick injury? Why we are concerned? The reason is there is transmission of bloodstream pathogens through the needle stick injury, and the most common infections or the viral infections we get from the blood are HIV, HCV, and HPV. As everyone knows, HIV and HPV does have the treatment. There are treatment modalities available for it. But for HCV, we are unlucky enough, we don't have specific medications. The HIV, the rate of transmission is 0.3%, for HCV it is 3%, and HPV it is 30%. So highest transmission is of the hepatitis B virus and least is the HIV. And once we know that patient is having HBV and we are having needle stick injury, then immediately that person has to be vaccinated. And before vaccination, we have to see the adequate level of antibody against HBV, and that is 10 international units per ml. Whenever there is a needle stick injury, please don't be very panic. We need to know the serology status of the patient. If we are not aware of it, then we need to advise to get the serology of the patient. If patient serology is negative, then it is very, very good. If the patient turns out to be positive for either of these three viruses, then accordingly we have to take the treatment. For HIV, there is antiretroviral medicines available. All medications are there. For HBV, vaccination is there. And for HCV, there is only supporting care what is available for us. Blood spillage. In ICU or in hospital, we come across blood spillage and other body fluid spillage also. So for this thing, what common things we need to keep in mind, that only is important, though this is a very busy slide. But what is important is always wear a pair of non-sterile gloves. Okay? And then whatever you are supposed to take, so use the pan or tongs or brush to sweep up the broken glass if glass pieces are there. Never try to take the things or touch these things with the naked hands. Okay, so that you will avoid sharp injuries. Use disposable paper towels to absorb as much of the body fluids or blood spillage is there. Wipe the area with water and detergent until it is visibly clean. And the solution which is used is sodium hypochlorite, that is 0.5%. That is, this is 1:10 dilution of 5.25% sodium hypochlorite bleach, which should be prepared daily. So once this is done, rinse off the tongs, brush and pan, whatever you have used, remove the gloves and discard them at a proper disposal. Wash hands carefully with soap and water and dry thoroughly with single-use towels. And this all thing has to be recorded. Record the incident in the incident book if a specimen was lost or there was a spillage. So this is a slide showing the spill management. So you have to keep only 5 things in your mind. First is to raise the alarm. Second is to use the PPE, that is the personal protective equipment. Then you have to control that part, contain and clean that thing. So this 5 things you need to keep in mind whenever there is a spillage of body fluid or blood. Then comes how to handle the contaminated material. The same thing which I had shown in the earlier slide. It is same that cleaning of the body or body fluid spills, wear gloves, wipe and paper or towel, apply disinfectant, cleaning and decontamination of the equipment, handling and processing of the linen, removing of reusable items, transporting infected patients, handling and processing lab specimen. That is for the strong plastic bags with biohazard labels have to be done. See, again, this is the revision of the same thing, but we need to keep this in mind and we have to follow the order or the sequence of management, how we are going to do it. If you miss a single step, then you are going to end up with either needle stick injury or sharp injury, or you may come indirect contact, or there will be direct contamination of the person who is handling this contaminated material, or at times the patient himself is very much contaminated or infectious. Then most important part of this all infection control is the biomedical waste management. What is the importance we need to, why we concentrate more on the biomedical waste management? Because we need to reduce its hazardous nature. We want to reduce the volume of the waste which is being produced daily in the hospital. We want to prevent misuse or abuse of the waste. Misuse or abuse means whatever the plastic material or the needles or IV sets or glass bottles, whatever we are using it, we don't want this to be used again or reused again. Okay, so this has to be prevented, because at times there are scandals going on when they used to refill the things again, they will lock it and again it will be in the market. So we don't want that. And again, what important is and we want to ensure the occupational safety and health of each and every person. That is the all healthcare providers who are there. We want to ensure the safety and health. So this is the classification of biomedical waste. Everyone might be knowing this. It is either non-hazardous or hazardous. If it is non-hazardous, to dispose it is very easy. If it is hazardous, then it has to be again divided into two parts. That is whether it is infectious or non-infectious. In infectious also, you have to see whether it is sharps, non-sharps, plastic disposables or liquid waste. And in non-hazardous, there will be discarded glass, pressurized containers, chemical, cytotoxic waste, and radioactive waste. Then this is the color coding system, and this color coding system which is shown or which is used, it is universal everywhere. Many a times, it few changes are there, but this almost remains the same for each and every hospital. See, if it is the yellow container, it is human and animal anatomical waste, soil waste, expired medicine, chemical waste, body fluid, clinical waste. Okay, and whenever we were working in the COVID, we used to dispose of all the PPE kit, gloves, everything in the yellow bucket. Then for the red, it is for the contaminated waste, which is recyclable, plastic bags, bottles, pipes, container, and catheters. White is for the sharpeners, that is like scalpels, blades, needles, syringes with fixed needle, sharp metals, needle tip cutter. Okay. And the fifth is the blue color one is for the broken glassware, cytotoxic waste, metallic body implant, contaminated glasses, including medicinal vials. So this four color coding you need to keep in mind at any point of time, even if you are wake up from your sleep, you should be able to answer which thing has to be discarded or disposed of in which color container. Then comes the isolation precautions. Whenever we are talking of the infection, whenever there is contagious disease, and as we had just gone through the pandemic of COVID, and now in last year we had cases of swine flu, H3N2 influenza. So we all, these are highly contagious diseases. So in order to prevent it, what matters is the isolation. So what is isolation? It is a separation and restriction of movement of ill persons with contagious diseases. And it is based on what? It is airborne precaution, droplet, and contact precautions. This is the slide which shows the standard precautions. It includes everything. It includes airborne, contact, and droplet isolation. And as it shows in the picture, it is very clear. You should always hand hygiene comes first in each and every step. So clean hands, gown, N95, mask, eye protection, personal protection equipment, gloves has to be there for standard precaution. For airborne precautions, um, um, organisms like Mycobacterium tuberculosis, rubiola, varicella, COVID-19, H1N1, H3N2, see all these are airborne precautions, and for that N95 mask is must. If the patient is conscious oriented, that patient has to wear it. The healthcare providers also are supposed to wear it. And how does it spread? That is by coughing, sneezing, talking, whispering. And this same thing applies even for the droplet precautions also. So for airborne isolation, clean hands and N95 or PAPR is required for the personal protection. For droplet, streptococcal meningitis, mumps, influenza, and procedures like suctioning and bronchoscopy can also cause this droplet transmission of the organism. And when they can be deposited, it can be deposited on the host conjunctiva, nasal mucosa, or mouth. So here also clean hands, mask and eye protection is must. For contact precautions, it may be direct to indirect and diseases like herpes, scabies, cholera, respiratory, skin and wound infections can be there due to contact. So we need to prevent this. For that, gloves and gown is must after doing a very good hand hygiene. What matters is the safety of each and everyone. So for staff safety, what we are supposed to do is to create awareness about the hazardous nature of the work. Everyone should be provided with protective equipment. There should be separate trolleys for the transport of waste, and there should be immunization. See, when those who are working in the hospital, each and every staff, if possible, who are dealing with such infectious patients or are involved in the management or disposal of their waste, they all should be immunized properly. What is the role of the infection control nurse? See, as I'm talking about the infection control in nursing, and everyone knows there is an infection control nurse in the hospital. So, what is her duty or his duty? Because they play a very vital role in prevention of infection, that is the spread of infection itself into the hospital. Okay, so they are supposed to take daily rounds in wards and high risk units. They are supposed to check, supervise, register, record, and supposed to take action. So this is their big job. Collection of samples from different areas of the hospital and sending them for lab. Whenever they have high suspicion that there is some contamination or spread of infection, they are supposed to do this exercise. And there should be continuous training of nurses and paramedical staff about the hygiene practices and aseptic technique. So what matters at the end is the health education. And for health education, there should be a continuous education to improve the practice. And once your practice improves, definitely you're going to give better performance in your life, in your routine activity. And as there is always the evolvement of the newer technology coming in, we come across so many new things day in and out. So continuous medical education will give us the knowledge what is coming in new for the infection control. We are supposed to follow standard precaution guidelines or the SOPs. Each and every hospital have their own SOPs according to their working environment. And immunization is must in the hospital. And after all these things, what we need to do is to regularly or continuously keep on evaluating that whatever exercise we are doing in the hospital to prevent the infection, whether is it successful or not. So we need to keep a check on it. So you need to see the success of infection control techniques, whatever new technique or whatever new strategy or guideline or SOP you have applied in the hospital, we need to see whether we are getting any improvement or there is no response to it. So we have to keep a check on it and we have to continuously evaluate ourselves. You have to compare patient's response to the actual outcome. See, whatever has been done, there are studies and we always see that doing this, there was improvement. So we need to check it onto the patient also, whether we are getting the expected outcome or not. So what important is the education management improvement. We have to identify the needs, self-learning objectives, identify resources of learning, implementation of the educational strategy, evaluation of learning outcomes, and follow. See, this is the continuous cycle and we have to be part of it. If we are into the self-learning objective and continuously into this process, then definitely we will evaluate in a better way and we will be able to give the best results or the outcome in infection control. So what is infection control program? It comprises of standard precautions, education and training of the healthcare workers, immunization, identification and minimizing the risk of biohazard, infection control practices and surveillance. So now my next slides would be on the infection control practices, what we are doing in the hospitals. So what are the ICU infection prevention strategies? And these are applicable to few of the most important hospital acquired infection, what we are seeing in the ICU, that is VAP, that is ventilator associated pneumonia, CLABSI or CLABSI, that is central line associated bloodstream infection or catheter bloodstream infection, or T, that is catheter associated urinary tract infection, SSI, it is surgical site infection, or at times even you see soft tissue infection also, and thrombophlebitis. So these are the 5 main or important hospital acquired infections which we see in the hospital, more in the ICU setting. And why we are concerned? Because the consequences of HAI are not good. The reason is they add into the morbidity of the patient. There is a prolonged stay, length of stay increases, so it will add on to the cost. And ultimately, long-term physical, developmental, and neurological sequelae. And this is both to the patient and relatives, and finally it goes to the social level also. And at times you may end up with mortality. So these are the very bad consequences of hospital-acquired infection. So we need to implement the preventive strategies in the ICU. So first we will see about the VAP. It is when more than 48 hours of mechanical ventilation is there in a patient. It may be early or late. Early it is within 48 hours and late is on ventilator but after 48 hours. Clinical pulmonary infection score calculation helps in diagnosing that. And what is VAP rate? VAP rate is number of infection upon number of mechanical ventilation days into 1000. So this is clinical pulmonary infection score calculation. How we do it? That is based on the tracheal secretions, chest X-ray infiltrates, temperature, leukocyte count, PF ratio, and microbiology. And if the score is more than 6, then definitely the patient is having VAP. So what is VAP bundle? See, VAP bundle comprises of 5 important aspects, and this is again the universally it is practiced the same VAP bundle. That is the head of bad elevation. The head of bad elevation should be between 30 to 45 degree. Oral care with chlorhexidine. There should be stress ulcer prophylaxis, daily sedation assessment and spontaneous breathing trial, deep venous thrombosis prophylaxis. So these are the 5 major aspects we need to take care and we need to see daily. Daily sedation assessment and spontaneous breathing trials is must uh, in a patient who is on mechanical ventilator. So sedation-free trial is must. Then comes the CLABSI or CRBSI. When both central and peripheral cultures have similar organism with central preceding the peripheral or more quantitatively, it is called catheter-related bloodstream infection. But if only, at times it may happen that only peripheral is positive with central line present within 48 hours, then it is central line associated bloodstream infection. And CLABSI upon central line days into 1000 will give you the CLABSI rate. What is the CLABSI bundle? Again, comes the first and foremost thing is the hand hygiene, aseptic precautions, sterile barrier precautions. You need to do skin anti-asepsis by chlorhexidine, optimal catheter site selection. Here, optimal catheter site means the site of insertion which is there, you have to preferably take it into the jugular or subclavian, and the least one is the femoral. The femoral is prone to get infected very early as it is near the inguinal region or at the perineal region of the body, so it becomes very much dirty. Daily review of the line necessity, which is again the most important aspect. We have to daily assess whether the patient requires a central line or not. Then comes the COTI. It is the COTI is catheter associated urinary tract infection, and it is the combination of clinical and microbiological data. The culture count here in the culture sensitivity report, you will get the colony count more than 10 raised to 5 per cubic millimeter, or number of per cells will be more than 10. And what is COTI rate? That is number of UTI upon number of catheter days into 1000. What is COTI bundle? Daily review of the clean of urinary catheter. Check the catheter is continuously connected to the drainage system. You need to do daily meatal hygiene. Regularly empty your urinary drainage bags as separate procedure. It should not be combined with the other activities. Ensure the bag is properly positioned, that is, it should be below the bladder and not touching the floor. Perform hand hygiene and don't blow and apron prior to each catheter care procedure. After procedure completion, remove gloves and apron and perform hand hygiene again. Then comes the phlebitis scale, visual infusion phlebitis score. And the nurses who are working in the ICU are aware of this phlebitis score, whether there are signs of phlebitis, whether there is a possible first sign of phlebitis. So how will you come to know that? Means you have to check the site, whether there is a pain at IV site or redness. If it is there, you need to observe it. If there is pain, erythema, and swelling, then you need to change, that is recite the cannula. If all of the above with induration or erythema is present, then you have to change the cannula and you have to treat also. Same, if it progresses further with the palpable venous cord, this is called the advanced stage of phlebitis or start of thrombophlebitis, where you need to recite the cannula and consider for the treatment. And if all these things are there with fever, then it is the advanced stage of thrombophlebitis. You need to initiate the treatment and recite the cannula. So, just to conclude, what I would like to say is that we have seen the most important 5 things which we see in the ICU, and these are the important aspects for the infection control program. So each and every part, if you see, what matters is the hand hygiene. The infection control starts with hand hygiene and ends up with hand hygiene. And in between comes, that is the standard precautions, means the use of PPE. PPE means you may require gloves or eye shield, whatever is required. Then matters, or the important part is the disposal of all these things. So biomedical waste management and this preventive strategies play a very important role in the infection control part. So I have kept few MCQs, and those who are listening to it, be very careful and just see the questions and try to answer it. I have given the answers in the next slide. So this is just for our self-evaluation. So don't worry, we are going to the MCQs. So which patient will you isolate in the ICU? If you are the ICM, then which patient will you isolate in the ICU? Acute pyelonephritis, meningococcal meningitis, community acquired pneumonia, etc. Which will you isolate? The ones who are having the paper and pen can write down the option in the pen and then can check in the next slide. I will give you the answer in that. What is the colony count in patients with COTI? 100 per cubic millimeter, or 10⁻⁶ per cubic millimeter, or 10⁻�3, or 10⁻⁵. So this is the correct answer. The one which you will isolate in the ICU is the meningococcal meningitis, and the colony count in the patients with COTI, it is 10⁵. Now, 2 more. Where will you discard the N95 mask? Which color coded basket or bucket you will discard the N95 mask? Blue, white, red, or yellow? And what is the percentage of getting infection from a needle stick injury from HCV positive patient? So the answer is, for discarding the N95 mask, yellow bucket is the answer. And for the percentage of getting infection with HCV is only 3%. Patient is having pain, erythema, and swelling near IV site. What will you do? Whether will you treat it with the IV antibiotics? Will you observe? Will you inform the infection control nurse, that is ICN, or a site cannula? And the other question is, the metallic body implant will be discarded in which color bucket? Red, green, blue, black. For the first, the answer is recite the cannula. You have to change the cannula. And for the metallic body implant, that can be discarded in blue bucket. In that bundle, rate of bed elevation is how many degrees? 20 to 30, 30 to 40, 30 to 45, or 40 to 45 degrees? Preferred site for central line insertion, femoral, brachial, jugular, subclavian. For here, the answer is, this is the slide. For the bed elevation, it is 30 to 45 degrees, that is option C. And the preferred site for central line insertion is jugular and subclavian. Both are correct answers. Preferably, if it is subclavian, less chances of infection compared to jugular. If sputum shows AFP plus 3, what will you do? Only isolation and airborne precautions, standard precautions, standard precautions and isolation. And what are the steps of hand rub? 4-step, 10-step, 8-step, 5-step. For AFP positive, standard precautions and isolation, and if for the hand rub, it is the 8-step hand rub or hand wash. So now I think we will start on with the question answer session. Everyone can unmute yourself and we can have the everyone can unmute yourself and we can start with the question answers if anyone has. Please be free to ask any question if you have. Does anyone have the questions or shall we end this session? I think if no questions, then we can end the session.
We'll wait for 5 minutes and then
Mr. Jayesh Kokia has asked, what is the best way to treat COVID patients? See, for COVID patients, again, the treatment modality is same. There is no change. What matters is, first is the isolation of COVID positive patient. Okay, and if patient is admitted, then the same COVID protocol we are supposed to follow. And if patient is at home, then again he needs isolation, N95 mask and personal protective equipment and everything has to be used the same way what we were using it. So there is no change for the infection control protocol. It is the same as it was before. If a cannula is still healthy, can we transfuse blood in the same line? Yes, you can. You can. What is the best way to COVID-19 positive patient intubation? This was the area of concern when we came across COVID-19 positive patients way back 3 years back. I'm talking of. At that time, everyone was very much afraid that we were all panicked. But with glasses or goggles and the protective shields, head protective shields, we can intubate the patient the same way as we are intubating the normal patients. Okay, and if in your hospital you are having the fiber optic bronchoscope or something like that, then you can go ahead with that, because there the transmission or the droplet transmission would be very, very less. So if you have that best facility, you can go with that. A live workshop demonstration of all measures will be more beneficiary. Yes, definitely. For learning, always workshops are more better compared to what we talk on online. Any more questions? Okay, thank you. I think we can end. Thank you, everyone. Thank you so much.